Hello, welcome to Midzone by Dr. Farjana Afrin. Today my video lecture topics joints of the upper limb. In this video lecture, I am going to describe about the different joints of the shoulder girdle and different joints of the upper limb also, the articular surface, their ligaments related with the joints, nerve supply and artery supply, lastly action of the each joint. So let's start. Now on screen you can see there are different joints on the upper limb. First let's start joint related with the shoulder girdle, or we can say pectoral girdle. There are two joints, sternoclavicular joint and acromioclavicular joint. After that shoulder joint is there, elbow joint is there, radioulnar joint is there. Radioulnar joints are three as two long bone parallelly arranged. So there will be superior, middle and inferior radioulnar joint. After that wrist joints are there. Then the whole hand or menas, there are number of bones. We know there are three segment bones, proximal, intermediate and distal, and they are forming some joints that are intercarpal joint, carpometacarpal joint, intermetacarpal joint, metacarpophalangeal joint and interphalangeal joint. So these are all joints of the upper limb. Now let's start from the very beginning. Now we are going to start from the sternoclavicular joint. On screen you can see there is sternoclavicular joint. I am writing in shortcut sternoclavicular joint. So what type of joint it is? It is a compound and complex variety of synovial joint. It is a compound and complex variety of synovial joint. It is a biaxial joint also. It is also a saddle variety of synovial joint. So how many information I said? According to the number of articular surface, it is compound and complex. As there are two axis movements, so it is a biaxial joint, and the nature of articular surface gives it a name, that is the saddle type of synovial joint. Now what are the articular surface? What are the articular surface here? Name is sternoclavicular joint. So in our mind it will come there should be sternum and clavicle, but very interestingly there are three articular surface. That's why we gave the name. It is a compound type of joint. So let's see. First of all, this is the clavicle, this is the manubrium of the sternum, and this is the first rib, costal cartilage. So this all three will be here making this sternoclavicular joint. Okay. So what are the articular surface? The articular surface will be the medial end or sternal end of the clavicle, number one, medial, or we can say sternal end of clavicle. Number two, there will be the manubrium. Here will be the clavicular notch of the manubrium, clavicular notch of manubrium, and the first upper surface of the first costal cartilage, first costal cartilage. So first explanation done. As there are more than two articular surface here joining, that's why we are saying it is a compound. Next things, in this inside articular surface covering the joint cavity, there will be a disc, and that is articular disc. So by this articular disc, the whole joint cavity is now divided into, you can see this is one compartment and this is another compartment. So it's divided into two compartments. That's why we are saying it is called complex type of joint also. So articular surface are three in number, and by the articular disc the whole joint cavity is divided into two. That's why we are saying it is a complex joint. Biaxial because two axis movement will be there, and saddle joint because of their nature of articular surface. Next question will come, what are the ligament here involved? Now on screen you can see there is a ligament which is connecting between the sternum and clavicle. Name of this is called sternoclavicular ligament. Then in between two clavicle also there is attachments of a ligament. Name of that is called interclavicular ligament. And there is one more ligament also which is related with the first costal cartilage, that is the costoclavicular ligament. And of course it is a synovial joint, there will be capsular ligament also. So what are the ligament? Number one, capsular ligament. Number two, sternoclavicular ligament. Number three, costoclavicular ligament. And number four, interclavicular ligament. These are the ligament. Now, these joints, it can do elevation and depression type of movement. Okay. Later on, movement related information again I am going to say. Let's start one more joint, that is the acromioclavicular joint. Now, acromioclavicular joint means the joint will be in between the clavicle and acromion process of the scapula. This acromioclavicular joint, it is a simple. That means two articular surface will be there and complex. Now, why there is complexity already we know, there should be a inside articular disc. So, inside this is the collarbone, clavicle, and this is the acromion process. The joint is here heading and this joint is divided into two cavity by the articular disc. That is why it is a simple as well as complex type of synovial joint. And according to the nature of articular surface, it is a plain variety of synovial joint. Now, what are the articular surface? If anyone asks you what are the articular surface, as there are simple, there are only two articular surface. One is the acromial end of the clavicle, or we can say lateral end of clavicle, and number two, acromion process of scapula. Simple. Okay. Then what are the ligaments here? Ligaments related with the acromioclavicular joint, as it is a synovial joint, so there should be a capsular ligament. Then there will be articular disc, and there will be a ligament related with the coracoid process. So, name of this is called coracoclavicular ligament. Coracoclavicular ligament. These are the ligament. Now, in a total, if we want to know this both joint, what are the movement take place? It is easy to remember because both have somehow the same type of movement. You just remember there will be elevation, there will be depression, there will be protraction, then retraction, then upwards rotation and downwards rotation. So, as a whole, these both joints can do these all movement: elevation, depression, protraction, retraction, upward rotation and downward rotation. Now, I am going to describe about the shoulder joint. Shoulder joint, it is a ball and socket variety. Ball and socket variety of synovial joint. And it also we can say multi-axial joint. Why multi-axial joint? Because different axes it can move. What are the axes? Anteroposterior axis, then transverse axis, then vertical axis. These are the axis wise movement can take place. Second questions will come, what are the articular surface? Articular surface, it is very easy, only two surfaces are there. One is the head of the humerus, another one is the glenoid cavity of the scapula. So, two articular surface, head of humerus and glenoid cavity of scapula. As the glenoid cavity you can see on the pictures, it is quite shallow and small compared with the large globular head of the humerus. So, surrounding peripheral area there will be a cartilage to make the deepen this cavity, that is called glenoidal labrum. Next, what are the ligaments related with this joint? A number of ligaments will be reinforced this joint. Number one, capsular ligament. Capsular ligament, also we can say glenohumeral ligament, from glenoid cavity till the humerus. And the ligaments are in three parts: superior, middle and inferior. So, glenohumeral ligament, capsular ligament has three components: superior, middle and inferior glenohumeral ligament, capsular section. Number 2, in between the coracoid process and humerus. This is the coracoid process. From coracoid process to humerus, there is a ligament. Name of this is called coracohumeral ligament. Then, in between the two tubercle, greater tubercle, lesser tubercle, there is a ligament which is breaching, and under that tendon of the biceps brachii will be going down. Name of this ligament is called transverse ligament. Transverse humeral ligament. Then there is one more ligament which is in between coracoid process and acromion process, as they are heading in between them. So, name of this is called coracoacromial ligament. Coracoacromial ligament. This coracoacromial ligament, along with the coracoid process and acromion process, it's making a arch. Name of this arch is called coracoacromial arch. I am writing here in shortcut coracoacromial arch. This coracoacromial arch, sometimes short notes came, and students have to know a little bit about that. Coracoacromial arch, it is a osseo-ligamentous structure. Why osseo? Because two bones are there. The osseo, there are two processes. What are the two processes? One is the coracoid process, another one is the acromion process. And what is the name of the ligament? Name of the ligament is coracoacromial ligament. Together with these osseo-ligamentous structures, it will be reinforce the shoulder joint, and the upward displacement of the head of the humerus will be prevented. So, what is the function of the coracoacromial arch? It prevents upward displacement of the head of the humerus. Now, we are going to discuss about the bursa. So, when we are discussing about the bursa, now we are going to discuss about the bursa. There are different bursa. Let's start. Here, let's denote figure A, and this is figure B. On figure B, from front view, if you see, there are number of bursa. Number 1, subscapular bursa, then subacromial bursa, then subcoracoid bursa, and subdeltoid bursa. All are sub, that means they are under. Subscapular bursa under the subscapular muscle, subacromial bursa under the subacromial process or acromion process, subcoracoid bursa under the coracoid process, subdeltoid bursa under the deltoid muscles. These are bursa surrounding the shoulder joint. On figure E, you can see the cross sections of the shoulder joint, and here again we can understand the all bursa. First of all, you just remember this is the acromion process, this is the coracoid process, this is the glenoid cavity encircled by the glenoidal labrum, and this green color, this is the capsule of the shoulder joint. This is important for us. Now bursa. First we will see just under the acromion process there is a bursa, and this bursa will be prevent friction between the bones and muscles underneath this bursa. Name of that is supraspinatus bursa, supraspinatus muscle. So what is the name of this bursa? As under the acromion process, so name is subacromial bursa. Now here you can see in front there is one more muscle, name of that is deltoid. So some sections of the subacromial bursa is under the deltoid. That's why this subacromial bursa we can say it is subdeltoid bursa also. So we got a bursa. This is the subacromial bursa. It is as it is prolonged more anteriorly and under the deltoid. So we can say it is subdeltoid bursa also. So subacromial bursa and subdeltoid bursa we got. Then if we see from the front side, there is a bursa that is under this subscapularis muscle. Name of that is called subscapular bursa. This subscapular bursa, inside it will be communicate with the joint. So it is intracapsular communication maintaining one bursa. You have to remember this point for the MCQ or viva. So subscapular bursa is communicating intracapsularly with the joint cavity. This subscapular bursa is under the subscapularis muscles. This is the subscapular bursa. Then posteriorly when we will see there is a bursa under the infraspinatus muscles. This is called infraspinatus bursa. This is the infraspinatus bursa. So here we got a number of bursa. Number 1, subacromial bursa. Number 2, subscapular bursa. Subacromial bursa extended down forwards and subdeltoid bursa will be formed. Then number 2, subscapular bursa. And number 3, here we got infraspinatus bursa also. Now we are going to discuss about the artery supply, nerve supply, movement and stability related with the shoulder joint. So here you see the artery supply, so suprascapular artery, circumflex branch of subscapular artery, anterior and posterior circumflex artery. Then nerve supply will be the suprascapular nerve, axillary nerve and musculocutaneous nerve. As it is a multi-axial joint, it will do flexion, extension, adduction, abduction, internal rotation and external rotation. And all the movement together we can say circumduction. Next, what are the factors maintaining the stability of the shoulder joint? It is a really very important topic. Number one, glenoidal labrum. As I said, the glenoid cavity is shallow. It can be deepened by the externally peripherally attached one cartilage, that is the glenoidal labrum. Then a number of muscles surrounding the joints, shoulder joints area. These are called rotator cuff muscle, named supraspinatus, infraspinatus, teres minor and subscapularis. The first three muscles will be attached into the greater tubercle of humerus and subscapularis is attached to the lesser tubercle of humerus. Then coracoacromial arch, as I said, it has two components. One is the bony component, that are the processes. What are the process? Acromion process and coracoid process, and there is a ligament, coracoacromial ligament. Then there are two muscles. One is the long head of biceps, which is an intracapsular muscle and strain the joint, and one is triceps muscles, that is also long head of the triceps. These two muscles will be maintain the stability of the shoulder joint. And lastly, atmospheric pressure. Now we are going to discuss about the elbow joint. So elbow joint, it is a uniaxial joint. And what type of variety? It is a hinge variety of synovial joint. Only flexion extension will be take place. Now on screen you can see the lower end of the humerus articulate with the upper end of the radius and ulna. So what are the articular surface? If anyone asks you, the articular surface will be the lower end of the humerus. More specifically, if we want to say the capitulum and trochlea. So articular surface will be the lower end of humerus. The 2 point will be here. One is capitulum, another one is trochlea, and the second things will be the head of radius and the trochlea of the ulna, trochlear notch and olecranon process of the ulna. So ulna, these are the articular surface. Now here you can see capitulum and radius attached, so there will be a humeroradial component, trochlea attached with the ulna, so there will be the humero-ulnar component. So if anyone asks you how many component you are going to get in the elbow joint, you can say there are two component. What are the two component? Number one is humeroradial component, number two is humero-ulnar component. Okay. Now if with this component again superior radial-ulnar joint also fixed, then it will be called the complex elbow, or we can say elbow complex content also. Okay. So that's all about the articular surface related information. Now a very important point related with the elbow joint is the arterial supply. For knowing the anastomosis around the elbow, we should have very good idea about the brachial artery, different branches of the brachial artery, and the terminal branches of the brachial artery, that means the radial artery and ulnar artery also different branches, which are making surrounding the elbow joint anastomosis and supply to the elbow joint area. So let's start first. Think like this is the brachial artery and two terminal branch of brachial artery. One is radial artery, another one is ulnar artery. So this is brachial artery, this is the radial artery, and this is the ulnar artery. So you just remember this is the lateral side and ulnar side, or we can say medial side. It will be easy for us to remember. Now from brachial artery, one largest branch is coming and going to back side of the humerus or posterior sides of the humerus in the radial group, and name of this artery we are saying it is called profunda brachii artery. So what is the name of this artery? Profunda, I am writing in shortcut, brachii artery. And from the brachial artery on the medial side we will see there are two more branches coming. One is called superior ulnar collateral artery, another one is called inferior ulnar collateral artery. So as it is coming above, so superior ulnar collateral artery, I am writing in shortcut, and this is called inferior ulnar collateral artery. These are the branches of the brachial artery which will be helping to make the anastomosis from above. Now come for the below two artery, one is the radial artery, another one is the ulnar artery. We have to remember the ulnar artery, there is a branch coming that is called common interosseous artery. The common interosseous artery, it will be again divided into two, one is anterior, another one is posterior interosseous artery. So what is this? Common interosseous artery, and this is the anterior common interosseous artery, and this is the posterior common interosseous artery. This ulnar artery branch. Then from ulnar artery there are also some branches, that is, one is called anterior ulnar recurrent branch, another one is called posterior ulnar recurrent branch. These two we have to remember, one is anterior ulnar recurrent and one is posterior ulnar recurrent branch. Similar, from the radial side also there is one branch is coming, that is called radial recurrent, that is called radial recurrent branch. What is this? Radial recurrent branch is coming from the radial artery. Now we have to make the anastomosis. From the profunda brachii artery, actually two arteries are descending. One is going back side, so posterior descending, one is coming front side, so this is called anterior descending. So this is anterior descending and this is the posterior descending branch of the profunda brachii artery. Anterior descending means it will be in front of the lateral epicondyle, posterior descending will go behind the lateral epicondyle. Now what happened, you just see the anterior descending branch of the profunda brachii artery will be make anastomosis with the radial recurrent artery. Then the posterior descending branch, it's coming down and behind the medial epicondyle, it will be make anastomosis with a branch which is coming from common interosseous artery. And again it is also going behind the medial epicondyle. So posterior descending branch will be make anastomosis with the branches which is coming from the common interosseous artery. It is called recurrent interosseous branch. What is the name of this? It is called recurrent interosseous branch. So anteriorly anterior descending and radial recurrent, posteriorly posterior descending and recurrent interosseous branch. They will be make anastomosis on the lateral side. Come for the medial side, medial epicondyle relation. Anterior to the medial epicondyle, there are two artery anastomosis. What is that? One is the anterior ulnar collateral branch with the anterior ulnar recurrent branch. Anterior ulnar recurrent branch. This is in front of the medial epicondyle. And superior ulnar collateral branch will go behind the medial epicondyle and make anastomosis with the posterior ulnar recurrent branch. So here what are the anastomosis in, if we do summarize, what are the anastomosis does we got? If we see on the medial side what are the branches, if we see lateral side what are the branches. On the lateral side if we see there is one branch anterior, another one is the posterior. So you just see radial recurrent, this is the radial recurrent. It will be anastomosis with the anterior descending branch. Anterior descending branch, it is a branch from the profunda brachii artery. This is in front of the lateral epicondyle. Now behind the lateral epicondyle there will be the recurrent interosseous branch, which is making anastomosis with the posterior descending artery. That also branch of profunda brachii artery. On the medial side if we see, there is superior ulnar collateral, inferior ulnar collateral, which is coming from the above. So let's first start. Anteriorly there will be inferior ulnar collateral artery. I am writing in shortcut. Anastomosis with the anterior ulnar recurrent artery, and superior ulnar collateral artery, it will be behind the medial epicondyle, anastomosis with the posterior ulnar recurrent artery. So laterally in front and behind there is anastomosis, and medially also in front and behind of the medial epicondyle there will be anastomosis. So here you see anastomosis around the elbow. 9 branches will be involved here. 4 descending branch, or we can say collateral branch. 2 descending branch from the brachial. You can remember there are 2 descending branch from the brachial, and 2 descending branch from the profunda brachii, as I said, 2 descending branch from the profunda brachii. Then ascending branch are 4 in number. One is 2 from the ulnar. You can see here 2 from the ulnar. These are recurrent branch of ulnar artery, anterior and posterior. One from the posterior interosseous artery. From actually it is not from posterior interosseous artery. It should be coming from the common interosseous artery. It is coming from common interosseous artery, that is the recurrent interosseous branch, and one is coming from the radial artery, that is the radial recurrent branch. So such a way they are making the anastomosis and supplying to the elbow joint. Now what is the nerve supply of the elbow joint? The nerve supply will be, I am writing here in shortcut, the nerve supply will be ulnar nerve, median nerve, radial nerve and musculocutaneous nerve. Sometime we also can ask you what are the factors making the stability or maintaining the stability of elbow joint. We have to remember number 1, pulley shaped trochlea. The trochlea shape is quite different. It's pulley shape, pulley shaped trochlea. Number 2, the jaw-like trochlear notch of ulna, jaw-like trochlear notch of ulna. Number 3, collateral ligament. A number of collateral ligament we are going to get here. Collateral ligament. So maybe they can ask you what are the ligament actually we are going to get. We are going to get different type of ligament: capsular ligament, radial collateral ligament, ulnar collateral ligament and quadrate ligament. So what are the ligaments related with the elbow? You have to remember number 1, capsular ligament. Then I said as like collateral ligament. Collateral ligament. How many collateral ligament? Radial side radial collateral ligament, ulnar side ulnar collateral ligament. Number 3, circumference of the head of the radius is covered by annular ligament. And number 4, there is a very specific ligament, name of that is called quadrate ligament. So related with the elbow, you have to remember the name of the ligament, the stability of the elbow joint, how maintained, the nerve supply, a very very important point, that is the anastomosis surrounding the elbow. Then elbow joints type, what are the articular surface. Now if anyone asks you what are the movement take place in the elbow joint, of course we can say there will be the flexion and extension. Flexion and extension. Now radio-ulnar joint. Starting time I already said there are 3 radio-ulnar joints: superior radial-ulnar joint, superior, then middle, then inferior. Superior radial-ulnar joint, it is pivot. Middle radial-ulnar joint, it is syndesmosis, variety of fibrous joint, and inferior also pivot. In the superior radial-ulnar joint, the ligament will be annular ligament. Then it will be also helping by the radial notch of ulna to accommodate the head of the radius. Inferior radial joint, there is also ligament. Capsular ligaments here will be. Ligament will be the capsular ligament. And there is a very important ligament, name of that is called triangular disc. This is very important in the inferior radial joint. What is their artery supply? All summarize if we see the arterial supply. The arterial supply will be the anterior and posterior interosseous artery. Anterior and posterior interosseous artery. What is the nerve supply? Nerve supply will be the anterior and posterior interosseous nerve. What are the movement take place? The movements very easy: supination and pronation. Now we are going to discuss about the wrist joint, or we can say radiocarpal joint. On screen you can see this radius and the carpals are attached, scaphoid and lunate. That's why we are saying radiocarpal joint, or we can say wrist joint also. What type of joints it is? It is a ellipsoid variety, or we can say the oval and socket like type of surface are here attached. That's why we can say oval and socket type of synovial joint, and it is a biaxial joint also. So it is a ellipsoid variety of synovial joint, and it is a biaxial joint. What are the axis movement here will be take place? Transverse axis and anteroposterior axis. Okay, and mainly movement will be in the biaxial joint here, flexion and extension, and adduction and abduction. Now if the carpals, if we see, we know scaphoid, lunate, then triquetral. Over triquetral there will be one more bone, that is the pisiform. And in the distal row, trapezium, trapezoid, capitate and hamate. Now in between carpals also there is joint. We are saying it is called intercarpal joint. Now this radiocarpal joint plus intercarpal joint or midcarpal joint, when they will be unite, we are saying it is called wrist joint complex. Next we have to know what are the articular surface of this wrist joint or radiocarpal joint. So there are two articular surface, proximal articular surface and distal articular surface. So proximal articular surface, let's write articular surface. So in proximal area the articular surface will be the inferior surface of the lower end of the radius. So number 1 is radius. Which area? Lower end. Which surface? Inferior surface. Then there will be the inferior surface of the triangular one, disc, which is very much important for formation of this wrist joint. So number 2 will be the triangular articular disc. Okay, this is the proximal. Then in the distal area also there are, what are that? Scaphoid, lunate and triquetral. So scaphoid, lunate and triquetral. These are the pisiform bones which will be also here helps in articulating. So articular surface related, these are the information. After that, next question will come, what are the ligament? A number of ligaments here actually attached. What are that? Capsular ligament. Number 1 we have to remember, there should be capsular ligament of this wrist joint. Then both sides there are collateral ligament, radial collateral ligament and ulnar collateral ligament. So we can write collateral ligament. Collateral ligament, two are there, one is radial, another one is ulnar collateral ligament. Then palmar radiocarpal ligament is there. I am writing in shortcut. Palmar radiocarpal ligament are there. Then palmar ulnocarpal ligament also there. Palmar ulnocarpal ligaments also there. And ulnar collateral ligament and dorsal radiocarpal ligaments are there. Number 5, ulnar ulnar collateral ligament, already I said here, radial and ulnar collateral ligament. And lastly there will be the dorsal radiocarpal ligament. So palmar 2, one will be the palmar radiocarpal ligament, another will be the palmar ulnocarpal ligament. In the dorsal there will be one dorsal radiocarpal ligament. These are the ligament. Next, related with the wrist joint, we have to remember what is its artery supply and what is its nerve supply. Artery supply and nerve supply same like the name. Artery supply will be the anterior and posterior carpal artery. And here same anterior and posterior interosseous nerve. Interosseous nerve. These are the information related with the wrist joint we have to remember. Next, what are the movement take place in the wrist joint? Already I said, as it is a biaxial joint, so movement will be two axes, anteroposterior axis and transverse axis, and the movement are flexion, extension, adduction and abduction, and circumduction also altogether when the movement will be. So the movement are flexion, extension, adduction, abduction and circumduction. These are the movement related with this wrist joint or radiocarpal joint. So radiocarpal joint related, these are the information we have to remember. Now we are going to discuss about remaining we can say bony attachments in the skeleton of the hand. Already I said intercarpal joint, or we can say mid-carpal joint also. Intercarpal joint. Now intercarpal joint, it will be held in between the carpals. Let's see again: scaphoid, lunate, trichotram, pisiform, then trapezium, trapezoid, capitate and hamate. Among them there is a joint. This joint we are saying it is called intercarpal joint. And intercarpal joint, it's a plain variety. Plain variety of synovial joint. Intercarpal joints, or in between the proximal and distal, these joints we are saying it is called mid-carpal joint also. Then there is one more joints in between triquetral and pisiform. This is pisio triquetral joint. Anyway, all the joints are plain variety of synovial joint. Then carpals attached with the metacarpal. Let's see: first, second, third, fourth and fifth. So this joint's name here which will be formed, this is called carpo-metacarpal joint. Carpo-metacarpal joint. As the 5 metacarpals are there, so 5 carpo-metacarpal joint. Among first carpo-metacarpal joint will be saddle. And this saddle variety of synovial joints, it has different type of movement: flexion, extension, adduction, abduction, opposition and circumduction. You have to remember, in the first carpo-metacarpal joint a number of movements happen. I am writing here: flexion, extension, abduction, adduction. A very important one movement, that is the opposition. For counting we are using this term, and circumduction. These are the movement in the first carpo-metacarpal joint. Articular surface, already we can understand the articular surface will be the trapezium and the base of the first metacarpal. This is the trapezium. So trapezium alone with the base of the first metacarpal. Here will be the articular surface. Then the remaining, that means 2 to 5th carpo-metacarpal joint, these are plain. These are plain. So here also the articular surface will be trapezoid and second metacarpal base, then capitate with the third metacarpal base, then hamate with the fourth and fifth metacarpal base successively. These are carpo-metacarpal joint related information. Now in between the metacarpals also there are joint. We are saying it is called intermetacarpal joint, and intermetacarpal joint happen from second to fifth metacarpal. So another one is intermetacarpal joint. Intermetacarpal joint also plain variety of synovial joint. After that, metacarpal will be attached with the phalanges. Which phalanges? Proximal phalange. We know each finger having 3: proximal, intermediate, distal. Proximal, intermediate, distal. Intermediate, or you can say middle also. Proximal, intermediate, distal. Except into the thumb there are 2: proximal and distal. So now first we will see the metacarpophalangeal joint. Metacarpophalangeal joint. Metacarpophalangeal joint, it is a ellipsoid variety. Ellipsoid variety of synovial joint. And metacarpophalangeal joint, it is a biaxial joint. So as it is a biaxial joint, again there will be two type of axis movement. What are the movement will be here take place? Flexion, extension, adduction, abduction, and there will be circumduction also. After that, the phalanges are interconnected in between proximal and intermediate and distal. So as they are three, there will be two joint, proximal interphalangeal joint, and this should be the distal interphalangeal joint. But here only one, that is the interphalangeal joint. So there are interphalangeal joint. If we write interphalangeal joint, for each finger from second to fifth, that means from the index till the little finger, there are two interphalangeal joint, proximal and distal. But for the thumb, only one interphalangeal joint. You just remember all the interphalangeal joints are hinge variety of synovial joint, and they are uniaxial joint. As it is uniaxial joint, only one type of axis movement will be there, that is flexion and extension. So that's all about the joints of upper limb. Thank you for listening.